Hi, I would like to discuss the ethical issue of end-of-life care in relationship to adolescent patients who have chronic illnesses. This is a very difficult issue for both the parents and the patient to face and must be handled with care. According to the article, Key Factors Affecting Dying Children and Their Families, which was published in Journal of Palliative Medicine by Hines and Baker, both parents and healthcare providers report lingering anguish if the child experienced any observed suffering. The dilemma here is how, as a nurse, to help the patient and the family when the end of life is near, particularly in cases where the adolescent patient desires no further interventions, but the family wants everything possible to be done. These are the options. 1. The patient makes all of the decisions. This could occur if the family is in denial and they allow the patient to make uninformed choices. Number 2, the family makes all of the decisions, which causes control issues with the child because they have no say-so in exactly what is going to happen to them. Number 3, the patient and the family are able to come to terms with the end of life and make the decisions together based on informed choices. Let's look at number 1. If the patient, who is a teenager, makes all of the decisions and the family allows this to occur, there will be feelings involved of anger and guilt after the patient dies because the family did not take a more involved stance. Number 2, if the family makes all of the decisions without discussing it with the child, then the child feels a lack of control over what is happening to them, and it promotes a lack of dignity as well. Number 3 would be the best choice for every person involved because it encourages conversation between the patient and the family. As a nurse, my role would be to help facilitate this conversation since I may have been the person that the patient first expressed questions to, or even the family expressed questions to, about the end-of-life process itself. This is autonomy in action. Even though the parents may ultimately be able to make the final decision on what will happen and how it will occur, the patient must feel like they have some control over it and understand exactly what is going to happen to them. As nurses, we have to promote the patient's right to autonomy and request proper intervention by other disciplines when needed, involving the physician, the social worker, child life specialist, clergy if needed, anyone that could help this family deal with this entire process.